Hello and welcome. Getting a diagnosis of triple-negative breast cancer can send you searching for answers, especially beyond the standard treatments. Today, we're going to explore some really fascinating new research into how diet and supplements just might play a supportive role.
Look, when you're facing something like this, it is totally natural to feel a bit overwhelmed. And it's also natural to want to become an active partner in your own care. You want to look at every single angle to support your health through it all.
And that desire, it naturally leads to a huge question. What does the science actually say? Beyond the standard medical treatments, what can you do to help your body in its fight?
So that's what we're going to do. We're going to explore 3 powerful and, in a couple of cases, pretty surprising discoveries from recent large-scale studies that are really opening up new conversations about supportive care.
Okay, first up is a supplement you've absolutely heard of, but maybe not quite in this context: vitamin D3, often called the sunshine vitamin.
Let's just start with a number that really jumps off the page: 49%. Now, this represents a pretty significant risk reduction for a specific group of patients. And here's the kicker. This wasn't just seen in people who happened to have high levels of vitamin D. This was found in patients who started taking vitamin D3 supplements after their diagnosis. And that's a huge deal because it points to the potential for doing something proactive. This quote from a big meta-analysis really just says it all. Across a bunch of different studies, having higher levels of vitamin D in your blood was linked to a dramatically lower mortality rate. It's a consistent finding that researchers are really paying close attention to. And the potential benefits don't even stop there. Other studies have connected having enough vitamin D3 with a better response to chemo given before surgery and a really significant boost in disease-free survival. This suggests the vitamin might be playing a supportive role in a few different ways. All right. Our second discovery, well, it comes from a place you might not expect. Think the allergy aisle at your local pharmacy. And now for another really powerful number: 68%. This is a huge reduction in mortality risk that researchers noticed in a specific group of patients who were taking a really common medication. So this finding actually comes from a massive study in Sweden. Researchers were digging through national patient records, and they stumbled upon this incredible connection in postmenopausal women who were using a common over-the-counter antihistamine called desloratadine. And the researchers themselves noted that these findings were, and I quote, especially promising for those with estrogen receptor negative or ER-negative breast cancer. Now, this group, which includes TNBC, has historically had fewer treatment options, which makes a finding like this all the more significant. Okay, our third and final discovery brings us out of the medicine cabinet and back into the pantry, with a focus on the humble flaxseed and the powerful compounds that are locked inside. This next number is pretty remarkable: a nearly 60% reduction in all-cause mortality. And this was seen in a group of patients based on something they were eating. So here are the details. The benefit was most pronounced in ER-negative patients who had the highest levels of these compounds called enterolactones. And it turns out our bodies create these compounds when we digest lignans, which are found in really high concentrations in crushed flax seeds. Now, while the study did find a benefit for ER-positive patients, the cancer-specific risk reduction was way bigger for the ER-negative group, 45%. That is a powerful finding that really puts a spotlight on a simple dietary addition. So, we've looked at a vitamin, an antihistamine, and a seed. They seem totally unrelated, right? But researchers actually think there might be some common biological threads connecting their potential effects. So what's the connection? Well, it could be a few things. These interventions might be helping the body's own immune system fight tumors better. Or maybe they're lowering systemic inflammation that can help fuel cancer growth. Or it could be as simple as making sure the body has the right balance of nutrients to work at its best. Okay, I have to be absolutely crystal clear on this next point. None of this is medical advice. We are simply sharing findings from research studies. We are not making prescriptions or recommendations. The whole reason we're sharing this information is to empower you, to give you data-backed points to bring to the single most important conversation of all, the one you have with your oncology cam. So, what do you do with this information? Let's talk about the next practical steps. It's a simple 3-step process. First, take a little time to review the studies yourself. Second, as you do, write down any questions that pop into your head. Things like, what do you think about this? Or should my vitamin D levels be tested? And third, bring those questions to your next appointment and just have an open, collaborative discussion with your doctor. You are your own best advocate. And as science continues to uncover these fascinating connections between diet, lifestyle, and treatment outcomes, it really points toward a more hopeful future. The question for all of us is, what will truly integrated and personalized cancer care look like? Thanks so much for joining us for this explainer.